Our next guest has stopped by dozens of times over the years. His patients, they share these remarkable stories. They get this relief from neck and back pain and I guess even migraines and fibromyalgia too.
We've heard about all of it. We're going more in depth today into the technique behind those results. It's called NUCCA, and it allows patients to heal naturally.
And Dr. Drew Drummond is with the Spinal Balance Health Center. Good to see you, Doctor.
Welcome back.
Yeah,
it's good to be here.
A lot of times you bring patients on, and we hear from these patients case after case after case after they were in so much pain for months, in some cases years, some cases decades.
Yep.
But let's dive a little bit deeper. What is NUCCA care, and how can it restore health for so many people?
Yeah, I met a patient, the new patient, a couple weeks ago. They watched your show like half a dozen times, maybe more than a dozen times, and he goes, God, I always wanted to come in and try it, but I just didn't think it would work. I didn't understand it well enough. So I thought this would be a good opportunity to maybe cater to those kind of people. But essentially what NUCCA does is it corrects problems with the nervous system. It gets your nervous system functioning better. And all body processes, whether it's posture or digestion or any kind of muscular movement, it's all controlled by your nerves. So your brain essentially has 10 trillion nerve impulses being generated every second.
Wow.
Sending them down through the spinal cord, like is being shown in this diagram, out to the body, and then the body in turn is sending trillions of nerve impulses back up through more than 40 miles of nerves. Everybody's body has more than 40 miles of nerves, and thousands of miles of nerve fibers if you add it all up. So with all these nerve impulses traveling at 300 miles an hour, it's a very dynamic system, and we don't think about it at all. It just happens. And what NUCCA is, it's a correction that corrects a misalignment at the top of the neck that disrupts this whole system. Your head moves back and forth and side to side on a little tiny bone called your atlas at the top of your neck. And through whiplash accidents, it becomes misaligned and starts interfering with this dynamic cascade of information and just breaks down the way the body functions. So we go in and we, in a very specific way, we analyze how that bone is misaligned. And probably, I bet 80 or 90% of the people I meet just in public have some kind of a misalignment. We look at their particular misalignment and put it back in the right place and allow that nervous system to then start working back in that dynamic fashion that it's supposed to. And all kinds of body functions start getting better. Not just chiropractors are known for neck and back pain, but that's only because posture is one of the things controlled by the nervous system. Yeah.
How do you identify candidates for NUCCA care? What goes into that?
The easiest way is to start looking at their posture. Like I said, posture is controlled by the nervous system. So when a person's posture is working correctly, there's a poster here. The picture on the right is showing somebody that's posture is accurate. The shoulders are even, the hips are even, the legs are even, and that's because all of the muscles are pulling evenly on the framework. And this creates a situation where gravity is being evenly distributed throughout that whole framework. The left side illustrates what happens when the very top bone of the neck is out of place. It causes an interruption to the way the brain stem controls the back muscles. And on the right side of the back, you can see how it's tighter and it is pulling the shoulder and the hip closer together. And then if you travel all the way down to the leg, the right leg of the left-hand person, it's short. So this physiological leg length difference that's created has to then be adapted for. And the common adaptations are low back and neck. So people end up with low back and neck pain. And I've even got a picture of one of my patients. She actually, months ago, she wanted a picture of this to show her friends because they wouldn't believe her. But if you look at Julie's picture, her right-hand shoulder, our left, is higher than the left-hand, her left-hand shoulder. And those lines behind her are 2 inches apart. So you can see that at the very curve of the shoulder from both sides, it's like 2 inches difference in her shoulder. So once we adjusted her, I laid her down from this picture, I adjusted her, and this is 2 minutes later. And she's, in both pictures, just sitting, she's relaxed, but now the shoulders are even, simply because the nerves controlling those back muscles are now pulling evenly.
After one adjustment.
Yeah, one adjustment.
Picture on the left side there, that left shoulder on the picture on the left, it is raised a little bit.
Yeah,
that's
yeah,
crazy.
and that's so I look for that. I look for all kinds of things. Yeah,
yeah. Well, can you talk about the adjustments, or are they're painless from patients?
Oh yeah,
we've
painless. Yeah. The adjustment itself is very overwhelming. I'll lay people down on a table, and there's a picture here showing that. They lay in a nice neutral position, and I'm bending over them, and just with a very gentle touch, a very specific adjustment, but very gentle, we move that bone back in the right position.
I would say watch her face.
Yeah, there's no flinch, and she
doesn't
Well,
move.
you hear from patients of traditional chiropractic care that say, well, I got my back popped, I have my neck cracked, and there's no popping and cracking.
There's a certain amount of force that needs to be put into a neck to get that kind of a joint cavitation. The top bone of the neck doesn't have discs above it or below it. There's no posterior joints, there's no musculature. And that makes it less stable, which is why it misaligns so easily, but it also makes it much easier to correct. So you don't have to have that forceful correction like you do with some of the lower vertebrae. But the lower vertebrae will respond. If you get the top of the bone in the right place, the muscles will pull the rest of the body back in place.
Yeah.
And that's why low back pain is probably the most common thing that I fix.
Well, NUCCA works for people when other things didn't.
Yeah.
I mean, they've sought all kinds of treatments and pills and different things, and then all of a sudden this is what works.
Yeah, our whole healthcare system has, over the last 100 years, just started, kind of directed itself to symptomatic care. A person has acid reflux, they go tell the doctor, I've got acid reflux, and they have a pill to suppress the symptom. Headaches, suppress the symptom. Back pain, suppress the symptom. No matter what it is, it's just suppress the symptom under the surface so we don't notice it. But very few people are going to the underlying problems that are actually causing these symptoms to bubble up. And that's what we're doing. It's looking at the underlying
Well,
problems.
there's people out there right now that are wondering, am I a candidate for NUCCA care? The first 15 people who call Dr. Drummond's office are going to receive a consultation, exam, and x-rays for only $50.
Yeah.
It's unbelievable. Phone number is 402-452-3400. And maybe you'll be one of these success stories walking around Omaha. It is a local company, so Dr. Drummond doesn't come in from somewhere else.
No,
He's
we're
a
right
local
here.
guy.
Hey, good to see you.
Yeah,
Thank
good
you,
seeing
Dr.
you too.
Drummond.
Thank you
Yeah,
very
appreciate
much.
See you.
All right.